Yes, so the problem of migration is a very old problem in the world. If we consider the history of Europe and if we consider data from genetic haplotype of the different population, we know that we were born from Africans that many thousands of years ago moved around the world. So the migration is an old history. Now it is a big problem because it was a massive migration from southern of the world to the north of the world with many political and economic problems. Migration is also important from a social, of course, from an economic point of view, but it's also important from a neurological point of view, because we will have new disease that we have difficulties to recognize. And this is true for infectious disease, but this is true also for many rare genetic neurological diseases that may present differently in relationship from the different origin of the family. Here, for instance, in Portugal, there are many cases of a rare condition that is amyloid polyneuropathy that became from the Azorean and was increased here in Portugal after the migration from the Azorean. This is a special type of disease in which the research here in Portugal is very much developed. So neurologists with this new situation need to learn more about the clinical phenotypic presentation of the different disease and to approach correctly to them. But there is also another big problem, that is the difficulty of first generation migration to go to give an access to the health system. They have a delay, and they have also problem of languages and to transfer the information to the doctor. And finally, I think that migration is a very important also resource for research, because we learned a lot during the past year about the geographic situation of many conditions. For instance, has been very much studied the differences in stroke in migrant of first generation and second generation, how the genes may be involved in the different phenomenon of the stroke, and has been also done a very big research for multiple sclerosis, because we learn that in the South Mediterranean area and in African area, the multiple sclerosis is lesser than in the North European countries. So it depends from the foods, it depends by the sun, it depends by the vitamin D or by the genes. And now there are many studies that consider that the environment is very much involved in the presentation of the different clinical condition. And we learned that, for instance, in France, the second generation migrating people has similar epidemiology for multiple sclerosis than French people, while first generation migration has a different epidemiological pattern that is similar to the origin country epidemiology. And this is a very interesting approach that we can consider also to learn much more about the physiopathology of many diseases. Yeah, the problem is the organization, the problem is a general problem of the hospital and how the hospital are organized. The access to the different health facilities that differ very much from country to country, and I think that we have to educate the neurologists to approach correctly to this disease and to know that some differences may exist and that has been considered. Yes, initially like this one has been derived by the organization of a study group in the World Federation of Neurology, where special people has been put together to discuss and also to teach about this problem of migration that is very important to open the mind to the neurologist that this problem exists. We take care of this problem, and we have considered not only from a practical point of view and health point of view. We know that, for instance, dementia may be much more frequent in migrating people because language is different, stimuli are different, and also the consultation for people is different, and we need to try to consider this situation and also to help these people agreeing to have also a good relationship and facilities and improving the health system to host these people.